First Local. Supported by Maker North, 3D printing, laser cutting, 3D design, education, prototyping, and more. Maker North, whatever it takes.
So, good afternoon. I want to first begin by thanking Ontarians for their continued vigilance in the face of this virus. Thank you for continuing to adopt the public health measures that help to reduce transmission and protect yourselves, your loved ones, and your communities from the severe outcomes of COVID-19. It is clear that we are in the sixth wave of this pandemic, driven by the BA2 variant. In the last few weeks, we have seen an increase in the percent positivity, an upward trend in wastewater surveillance, and a rise in hospitalizations. These trends are likely to continue for the next several weeks, but there are actions that we can take to help manage the impact of this wave, such as layering the personal protective measures we have adopted so well over the last 2 years, even when they may not be legally required. These include a strong recommendation to continue wearing a well-fitted 3-layer mask or use of a medical mask in all public indoor settings. And please continue to respect the ongoing mask requirements that remain in place, including in hospitals, in other healthcare settings, long-term care homes and retirement homes, congregate settings that provide care and services to medically and socially vulnerable individuals, such as children's treatment centers, in shelters, public transit, as well as the federal requirements for returning international travelers. I also want to remind Ontarians that if you test positive for COVID-19, you should continue to wear a mask at all times for 5 days following your isolation period, and avoid vulnerable people in places like hospitals and long-term care. Also, for masking, household and other close contacts of a COVID positive case are reminded that they should be wearing a mask at all times and avoiding vulnerable individuals and settings for 10 days. While we will not be reinstating a broad mask mandate at this time, we should all be prepared that we may need to resume a requirement for mask wearing in indoor public spaces if a new variant of concern emerges, a threat to our healthcare system, or potentially during the winter months when COVID-19 and other respiratory viruses are likely to circulate again. Vaccination remains one of the most important tools to protect ourselves and our community against the impacts of future waves of COVID-19, and it is critical to stay up to date with your vaccination by receiving all doses recommended. As COVID-19 transmission increases, getting a booster dose if you are eligible, and especially if you are at high risk, is very important. It's your best defense against severe illness, hospitalization, and death. Booster doses save lives. If you've not booked an appointment for your booster, please do so as soon as possible to ensure you are protected against severe outcomes of COVID-19. In addition to vaccines, antivirals are another tool the province is using to manage COVID-19 and are free of cost. Antiviral treatment, including the oral antiviral Paxlovid, can help to reduce hospitalizations, protect hospital capacity, and protect patients at high risk of severe health outcomes. Individuals can access oral antiviral screening tool online at ontario.ca/antiviral screener to help determine if they are at high risk for COVID-19 and its complications and should be assessed for treatment. Individuals who are part of high-risk groups and who have COVID-19 should immediately seek testing and care by contacting their healthcare provider or visiting one of the many clinical assessment centers across Ontario. Even if you don't have symptoms, talk to your primary care provider in advance to see if the treatment is right for you in the event that you get sick, and have a plan. Healthcare providers can also determine if antiviral treatment is appropriate for patients based on individual circumstances, even if they do not belong to one of the high-risk groups. So as I've said before, the pandemic certainly is not over. We're now in the sixth wave, and the virus continues to circulate and evolve. Learning to live with COVID and the expected rise in COVID cases because of the highly transmissible BA2 variant it is strongly recommended for all of us to, number one, screen daily for any symptoms of COVID-19. Stay at home when you're sick, even with mild symptoms. Wear a mask, especially in indoor public settings. Maintain your vaccinations. A booster dose can save your life. Assess your risk before going out. Antivirals now determine if they are right for you and immediately seek treatment if you become ill and are at high risk for severe COVID infection. Have a response plan. If symptoms develop, know where you can get tested and how to contact your healthcare provider. And test if you have symptoms. Maintain access to RAT or know where you can get your PCR testing if you're eligible for treatment. As we learn to manage and live with COVID-19, use the tools available to us to continue, and this will continue to have a critical impact on our health and health of those living in our communities. Thank you. So happy to take some questions.
Dr. Moore, you said you anticipated a rise in the virus, but we're now seeing, by all accounts, 100,000 cases or more per day. Why were you not out here talking to Ontarians, telling them that's what we're seeing, so those at risk can best assess the risk? Why were you not out here talking about that?
The data has been available to all Ontarians, and many medical officers of health and leaders across the health system have been responding to a lot of these questions. We've known that as we remove public health measures that we would have a rise in incidence across Ontario, and hence the reason we have our 3-point plan. Continue to wear a mask, continue to get vaccinated, ensure that you keep up to date with your boosters, and know if you would be eligible, after discussing it with your healthcare provider, for antivirals. Those three major platforms will help Ontario through this next wave. We have 30 to 40,000 treatment doses or treatment regimes of Paxlovid available to Ontarians, and I want to make sure that they're used for the most at risk for the severe outcomes of COVID-19 across Ontario, and I think we've worked robustly over the last week to ensure that that plan is in play now. So as of tomorrow, we hope to announce of the 4,700 pharmacies which will be participating in the dispensing of Paxlovid. We hope to continue the education with primary care providers to ensure they're knowledgeable about how to prescribe it, as well as work with all of our health system partners to ensure that they're knowledgeable on how to prescribe it safely for Ontarians to prevent this potential risk and rise in hospitalizations in the coming weeks.
Public Health Ontario is calling for a return to masking, especially in places like schools. Why don't you bring masking back in schools? We've seen a big influx in ERs of young people with COVID. Why not mandate masks in schools?
So it's important to put that in perspective. Today, there's been no significant rise in the risk of children in the intensive care unit. So of all of Ontario, 2.75 million children, there's 2 in the intensive care unit right now. On average, we're having 30 to 60 children admitted to hospital. Some of those are incidental admissions to hospital as well over a 1-week period. So we've not seen any significant threat to the health of children. We do absolutely encourage children to do all those basic steps of screening before they go to school. Use the RATs, those tests that are distributed on a weekly basis to all students across Ontario, to ensure you take advantage of the immunization strategy. So I think it was 55% of those 5 to 11 have taken advantage of first doses. Great response for first and second doses in high school students, but would love high school students 6 months after their last dose to get their booster as well.
Doctor, you said that that we know all of these things, but you're coming out here saying, do risk assessments before you leave, which is much different, in fairness, to just saying we need to learn to live with COVID. So can you honestly say to Ontarians that as they've been seeing these cases rise, that it's appropriate that you have not been out here, even on a bi-weekly basis, to explain this is where the situation is, this is where you need to be looking at it now?
So the purpose of coming out today, as you know, my last press conference, we told you I'd come out if there was an issue. The purpose today is to remind all Ontarians that they are eligible for boosters. 60 and above are eligible for their second booster, and I got mine yesterday. It was easy to book, able to go to a local pharmacy, didn't have to wait, and the pharmacy was great in providing the vaccine quickly to me. So over 60, please get your second booster if you're eligible, and that's roughly 5 months after your last dose. As well, be knowledgeable of if you're eligible or high risk for hospitalization to COVID, speak to your healthcare provider and know that, if you can get access to Paxlovid, as well as continue to wear a mask. The purpose of coming out today is just to reiterate, yes, we're in the sixth wave. Yes, we will see a rise in admissions to hospital and to the intensive care unit. But as always, we have tools that can mitigate that and prevent it for all Ontarians. And to call once again for people to come forward and get immunized. We've seen the rise in numbers, so we're up to 20,000, I think, yesterday got immunized with third and fourth doses, which is brilliant, but I'd love to see more Ontarians. We have capacity to immunize higher numbers than that, both through your local pharmacies as well as through mass immunization clinics, and there's tremendous capacity in the system that's not being used. So please, all Ontarians, yes, we're seeing a rise in risk, and that will be for the next probably 6 to 8 weeks that we'll have a rise in risk of transmission. And we have the tools to mitigate it, either through immunization. If you don't take advantage of immunization, there are oral outpatient therapies that are provided free of charge to all Ontarians, no dispensing fee, and we'll know tomorrow how many of our pharmacies across Ontario of the 4,700 are partners in ordering and dispensing, and that will be online as well. So two new messages that I'm here to provide to Ontarians to ensure that they're aware of.
So with respect, you didn't answer my question. Is it appropriate for you to just not be coming out here when there are, when you should likely be explaining the situation? Is it fine to just leave it up to people to be figuring it out on their own? Or do you feel that you're not required to be coming out here on a daily basis or even bi-weekly? Or is this the last we're going to see of you for another month?
No, well, if I have new messaging of risk to any of the citizens of Ontario, I absolutely will come out. We share all of our key messaging, and we did this last week with all of our local public health agencies, all of our health system leaders, as well as our hospital leadership on the fourth dose, second booster strategy, as well as the oral antiviral. It's responsibility of all of our healthcare leaders across Ontario to disseminate this information at a community level, and I'm happy to come out on a more regular basis if that message needs to be promoted.
Do you think that if the 100 to 120,000 cases a day that some are claiming, like Dr. Uni, do you think that that is accurate? And if it is accurate, doesn't that mean that this strain is having much less impact on Ontarians if we're at 120,000 cases a day, but hospitalizations have not gone up dramatically?
Well, it's a really good point. It's a testament to the benefit of being immunized. And you're seeing a much differential risk of being hospitalized if you're not immunized. It's 4 times higher risk to get admitted to hospital, a 6 times higher risk to get admitted to the intensive care unit if you're not immunized. So what we're seeing is, even with increasing incidence, we're seeing the health system is being protected through strong immunity, either through acquired immunity, and we estimate maybe 5.3 to 6 million Ontarians have already had just the Omicron wave since December. And with these additional cases, we're not seeing the same ratios that we saw in previous strains of, we used to have, for every 100 patients, we'd have 1 admitted. We're not seeing that because of the benefits and strengths of immunization. So thank you for raising that question. It's a testament to the power of immunization, and I really, after 4 to 5 months, our immunization benefit fades and our antibodies decline. And at this point, 5 months after your booster for those 60 and above, I'm really asking all Ontarians to come forward and get their booster. That should protect you against hospitalization. Our goal as a province is to ensure Ontarians remain healthy and safe and don't need to be required to be hospitalized, don't need intensive care, and don't succumb from this virus. And the strategies that help us are immunization. That's the number one that's helped us through this. Number 2 is now with the 30 to 40,000 doses of Paxlovid. That's an additional tool in our armamentarium that can really safeguard our health system or protect Ontarians.
On the issue of risk assessment, you've said we should be doing our own risk assessment, but when you look at the reaction that some people have to COVID, do you think that people, even 2 years in, know what the actual risks are? Hearing stories of young people getting infected and seeking Paxlovid, even though they're not at risk. We hear a lot of parents acting as if schools are as dangerous as long-term care settings. Do we adequately know the risks? Have you established what those risks are for the public, or do we need to be putting that out there more instead of acting as if everyone faces the same level of risk?
Well, again, a great question. So I follow very closely the impact on children in Ontario. I want to ensure that we protect our children as much as any parent, and I'm following the admission rate. It is roughly 5 per 100,000 children that have needed to be hospitalized. The mortality rate, I think we've had 10 children die over 2 years from COVID, and for the most part, and I'm sorry for any child that has had to succumb from this virus and to their families, but for the most part they have had comorbidities as well. So at a general population level, the risk to children, given that we've got significant immunization protection, very significant protection in the high school settings, is quite minimal at present. But we'll continue to monitor that in case there's a strain differential. Those that are most at risk for this virus, and it's very important because it would allow you to start to understand whether you'd be eligible after a clinical encounter for Paxlovid, are those that are over 70. We're finding the admission rate is still very strongly correlated to age. So if you're over 80 or 70 or 60, those individuals have the highest admission rate. So please, that's why we're here today, to talk about maintaining your immunization, maintaining your booster status for your first booster or your second booster. And if you're 70 and over, even if fully vaccinated, if you have significant risk factors, you may be assessed by your clinician, your healthcare provider, to be eligible for antivirals. From 18 to roughly 60 years of age, you'd be deemed at high risk if you had significant comorbidities. So you had a serious neurologic condition, cardiac, lung, liver, kidney, immune deficiency, HIV or AIDS. That would make you potentially eligible after your clinical encounter for Paxlovid. But in that instance, if you were fully immunized, you'd be most likely less risk for hospitalization. So thanks for raising that question. Very important that all Ontarians know what their personal risk is. Based on what I've just mentioned, have a discussion with your healthcare provider in advance if you would be eligible for Paxlovid, and have a plan to test. All individuals who would be eligible for treatment would be eligible for any of our PCR testing across Ontario, and hence the reason we want to maintain that rapid turnaround, because you need to get assessed within 5 days of your initial symptoms. You need to have that test back. We will accept a positive RAT test if you've got access to that or done it at home, by the way.
Are you still planning on ending the mask mandate on the 27th for long-term care homes and transit?
Oh, we're actively reviewing it. So thank you for that question. Clearly, we think this wave is not going to be settling till the middle or end of May. And as a result, we're looking at extension for all of those high-risk facilities. Anyone in those congregate settings, shelters, retirement homes, long-term care homes, and transit, absolutely considering maintaining it. Our team's drafting it. We'll present that to government, and the government will make the final decision. But to me, that makes tremendous sense to maintain it.
Can you be more clear about, I know you said you're recommending well-fitting masks, that people wear them, but can you be clear about why you are not making it mandatory in a setting like a school, for example?
Well, we are very mask friendly in Ontario. We're absolutely still providing free masks to workers, the 300,000 workers in that environment, the 2.75 million children. Those are provided free of charge, absolutely embracing that they can and should be used. But we've already responded that an individual risk is exceptionally low for hospitalization in that setting, for severe outcomes in that setting, and want to also continue to promote immunization for all those children that haven't had their booster dose from 12 to 18, or who haven't got their primary series from 5 to 11, which is still 40% of children.
But when it comes to individual risk, there's individual risk, and then the fact that we're hearing about all these people being offered the job.
About healthcare workers and ensuring that we have healthcare workers that can provide care. We know the sick absence has increased, and clearly have to monitor that. So Ontario Health is monitoring that very closely. provide care to those individuals. I also just would like to intimate it's very important to follow causative admissions versus incidental admissions. So the causative admissions today in Ontario are only at 45% of all admissions. And for the intensive care unit setting, I believe it's at 65% today. So when we report 180 admissions to hospital in the intensive care unit setting, take into consideration it's 65% that are causal, that you may have had a motor vehicle collision, you may have had some other medical issue, and incidentally tested positive by PCR, because PCR testing can stay positive long after you've recovered from COVID. So there's some nuances to the data and the projections and the modeling that we have to review very, very closely. But despite that, Ontario Health has given us assurance that we have capacity in Ontario to care for all Ontarians, even with the projection of a number like 600 individuals in the intensive care unit. It's my goal as a prevention specialist to ensure that Ontarians are aware of that risk 4 weeks from now, to ensure that they get their booster dose of vaccine, to ensure that they're aware that there are treatments now, abundance of treatment options, including over 40,000 doses of Paxlovid that we'd love to be able to distribute and prevent admissions to hospital and ICU, and hence the reason I'm out today.
Last question.
Are you willing to
all the measures like a month ago? We've talked about knowing there's going to be another wave. Did you know it would be this big or eventually get to 600 people in the ICU?
We absolutely knew BA2 was going to be circulating, and we have seen that there is a benefit from being immunized against BA2. There's still strong protection levels. It's just that over time your protection levels do fade from around 90% protection against BA2 to 80 to 70 to 60 over time. And hence the reason I'm here today to really promote the booster dose of the vaccine that we announced last week, and also in anticipation of that risk to ensure that all Ontarians are aware that there is now much more abundance of outpatient treatments that I hope the 4,700 pharmacies are willing to dispense, and we'll have that up for you tomorrow to be able to assess, and that we've done a tremendous amount of education over the last week for all of our primary care providers, specialists, and emergency physicians to ensure that they're aware of how to safely prescribe this medication so that it can be put in best use to prevent that modeled rise in admissions to the hospital sector.
Thanks, guys.
What's happening in Kingston?
We're going to take one more question, then we got to go.
Can I just ask, with Kingston, there's very, very high rates there. What specifically is leading to that happening in that specific region? Well,
that's another good example. So I think Kingston's at over 450 cases per 100,000 today, and they've remained at a very high level of detection of cases as well as infection. And yet, I believe today they had 9 people in hospital, and 50% of them would be incidental admissions, so roughly 5 admissions to hospital. So it tells you they have one of the highest immunization rates in the province, that a strong immunization strategy, strong first dose, second dose, third dose, fourth dose strategy can prevent the health system impact, can mitigate the negative effects, given that our goal for all Ontarians is to minimize morbidity, mortality, but also minimize societal disruption. And I look at KFLNA, and that gives me hope that in the coming weeks that we as a province can do the same. Also watching Peel very closely in Halton, that had over 50% last week of their cases being BA2, and yet they haven't had a significant impact on their healthcare system. Their admissions to hospital have remained relatively stable, and their capacity to care for Ontarians is stable. So, these are examples. They're early waves of BA2 and very high community transmission, but because of the robust protection that we as Ontarians have all taken advantage of, we're not seeing the health system impact that could have occurred. So please, if this is the last question, I had 3 messages to come out with today. Please stay up to date with your boosters. Boosters can save your lives. If you haven't taken advantage of our immunization strategy in Ontario, please consider getting your first or second dose. It's never too late. Please also realize if you're in the high-risk group for a severe outcome from COVID-19. Realize now that there's therapies. Discuss that with your healthcare provider in advance. Have a test and treat strategy that you can put in play if you develop symptoms of COVID-19. These can all mitigate this BA2 wave that is upon us and protect our own health, our family's health, but also our health system.
Thank you. Thanks, everyone. We got to get going. Thank you. Thanks, everyone.
Dr. Moore, you said just quickly on